non-invasive prenatal test. Non-invasive prenatal test, or NIPT, or sometimes called non-invasive prenatal screening, is a method determining the risk that the fetus will be born with certain genetic abnormalities. The test analyzes small fragments of DNA that are circulating in a pregnant woman's blood. Unlike most DNA, which is found inside the cell's nucleus, these fragments are free-floating and not within cells, and so are called cell-free DNA. These small fragments usually contain fewer than 200 DNA base pairs and arise when cells die off and get broken down on their contents, including DNA, are released into the bloodstream. During pregnancy, the mother's bloodstream contains a mix of cell-free DNA that comes from her cells and cells from the placenta. The placenta is tissue in the uterus that links the fetus and the mother's blood supply. These cells are shed into the mother's bloodstream throughout pregnancy. The DNA in placenta cells is usually identical to the DNA of the fetus. Analyzing cell-free DNA from the placenta provides an opportunity for early detection of certain genetic abnormalities without harming the fetus. An IPT is often used to look for chromosomal disorders that are caused by the presence of an extra or missing copy of a chromosome. Primarily, an IPT looks for Down syndrome, trisomy 18, trisomy 13, and extra or missing copies of X chromosome or Y chromosome. The accuracy of the test varies by disorder. An IPT is considered non-invasive because it requires drawing blood only from the pregnant woman and does not pose any risk to the fetus. An IPT is a screening test, which means that it will not give a definitive answer about whether or not a fetus has a genetic condition. The test can only estimate whether the risk of having certain conditions is increased or decreased. In some cases, an IPT results indicate an increased risk for a genetic abnormality when the fetus is actually unaffected, or the result indicate a decreased risk for a genetic abnormality when the fetus is actually affected. There are multiple NIPT methods to analyze fetus cell-free DNA. To determine chromosomal aneuploidy, the most common method is to count all cell-free DNA fragments. If the percentage of cell-free DNA fragments from each chromosome is as expected, then the fetus has a decreased risk of having a chromosomal condition. If the percentage of cell-free DNA fragments from a particular chromosome is more than expected, then the fetus has an increased likelihood of having a trisomy condition. A positive screening results indicates that further testing, called diagnostic testing, should be performed to confirm the result.